Hi, I'm Dr. Christy of Body Bar MD. I'm going to kind of go through the way I do an initial consult with patients that we see here. Oftentimes, it might be for weight loss, it might be for hormone imbalance. Those are probably the two biggest things that we see. And from my perspective, they all kind of go together. So I'm going to end up kind of talking about all of them. I would say most of the time, people that come to see us they're frustrated. They are gaining weight or they're not losing weight despite everything they do. Generally, people are eating pretty healthy. I don't have a lot of people coming in saying, oh, yep, I eat fast food all the time. Generally, people are trying to do the right things. They're confused, they're overwhelmed, they get mixed messages, but the most frustrating thing is that absolutely nothing that they are doing is working. And then there's the secondary piece of it, particularly for women, but men certainly experience it as well, where they just don't feel like themselves anymore. They feel like they're having hormone imbalances, which to them might be fatigue is probably the biggest complaint that we see. They're just exhausted. To get through their day, they just have to gut it out, but they're exhausted at the end of the day. Sometimes they're achy. They don't have a lot of motivation. Sometimes they even experience a little bit of anxiety. They just feel kind of overwhelmed at life, and they didn't used to feel that way. They're not sleeping well. They have brain fog. They just aren't thinking like they feel like they should be. They're exercising, and again, they're not losing weight. Worse yet, they're working out and they're not seeing any gains from their workout. They're not gaining muscle for the effort that they're putting in. They're not seeing the results. I would say those are probably the biggest things that we see. Sometimes then it goes even a little bit further where there's no libido, there's no motivation. They just kind of don't care. And they've all but given up. And unfortunately, a lot of times they've gone to their doctor. They've asked them to check their hormones. They've asked them to check their thyroid. They've talked to them about their weight, and they've been told that their labs are fine or that they're normal. But they come to me and they say, but I don't feel normal and I don't feel fine. Something is going on with me. And my answer is, you are 100% correct. You are absolutely right. There is something going on. And that's really kind of what we focus on. From a weight perspective, metabolism is so complex. It is not just what goes in, what goes out. Or the classic line is, if you would just eat less, move more, your weight would come off. Again, most people come in, they're like, I know what to do. I just don't have the motivation to do it. Or even when I try to, it doesn't work. So, a big part of what we do, yes, there's a laboratory evaluation. I mean, we look at a full thyroid panel, a full metabolic panel. Insulin resistance is the precursor to all of the weight problems, PCOS, pre-diabetes, diabetes. 1 in 3 Americans are pre-diabetic right now and have no idea. And again, if you're not checking insulin levels and looking at what our optimal range is for labs, it's going to get missed. So by and large, anybody walking through our doors that is struggling with their weight is insulin resistant by definition. Thyroid is the same thing. People end up with thyroid dysfunction. Their brain is putting the hormone out to tell their thyroid what to do, but the organs may not be responding to it. So again, there's normal ranges for thyroid, and then there's optimal ranges for thyroid. So we're going to look at all of that. And then, of course, there is the dietary aspect of it. And I even hesitate to use the word diet because it just really isn't part of our philosophy. I really like a good nutrition plan. And one of the things that we focus on, and we probably focus on it more than patients do. A lot of patients come in and they've got that dieter's mentality. They are awesome at losing weight and they have lost hundreds of pounds in their lifetime, but they can't keep it off. So we spend a lot of time kind of backtracking out of that dieter's mentality and getting more to a concept of how are we going to fuel our body, and talking about good nutrition and fueling our body and getting a healthy, good metabolism for the rest of our life. So it's something that takes time. This isn't going to be a one and done, how fast can you lose the weight type of program. It's definitely, it's that what we call biopsychosocial model. So it's incorporating all of the things that go into weight and weight management and weight maintenance and relearning all of the bad information that people get from the internet, from books, from their friends, from all of social media, that oftentimes aren't based on science. And that's really what we try to focus on. And again, I am much more interested in someone's long-term metabolic health and teaching them how to keep their weight off, but also being realistic about it. This is not a program where it's going to be, this is super strict. You have to do all this or you're going to get kicked out of our program. I don't believe in that concept. To me, it's a journey, and we go through that with you all along the way. That's going to be birthdays and vacations and real life and, okay, I'm going to take the summer off. What's that going to look like? It's all of those things. From a hormonal standpoint, that plays right into it. Women going through perimenopause and menopause tend to start gaining that midsection weight. We call it, menopause belly. And part of that is because as our estrogen levels go up, fat cells have estrogen receptors on them. So our body is actually trying to hang on to that last little bit of estrogen. So even women who have never had trouble around their midsection, as they start getting toward menopause, will start gaining weight. Men start seeing it too. Men who've, historically been able to stay pretty fit will start getting a little bit of the dad bod. That's that andropause, that menopause, as our hormone levels start to diminish. And then unfortunately, it all comes at a time we're gaining weight, our hormone levels are going down. So then energy starts going down, motivation starts going down, and people just end up in this spiral and they don't know which way to turn. One of the things that is most surprising to people about women's hormone levels is that we actually make far more testosterone as women than we do estrogen. And it is a wholly overlooked aspect of women's health, our sexual health, our muscular health, our mood, our motivation, libido. So one of the things that, younger, let's say, mid 30s to 50, so that true kind of premenopausal female will come in and they feel like there's a hormone imbalance, but they're not in menopause. So there's this, notion that the only hormonal help that they can have is from estrogen replacement. Well, we don't really need estrogen replacement until we're postmenopausal. But that's where testosterone replacement plays a role. By the age of 35, our testosterone production is half of what it was. So women are starting to experience really what I call low T for women. We hear a lot about low T for men. It's all over the internet. All they have to do is, open an eye and they see it. But for women, it's a real thing, and it's all those same things. It's fatigue, loss of motivation, lack of libido, loss of muscle mass, weight gain, brain fog, anxiety, poor sleep. All of those can be a hormone imbalance. And again, to me, there's so much overlap between nutrition levels and our thyroid levels and hormone levels, that they all just kind of go together. It's often difficult to tweeze out that it's just one thing. When I see a new patient, though, what I do try to determine is the main complaint. So some people come in and it is very clearly that the hormone piece is really what's driving their symptoms. And yes, they're concerned about their weight, but it's the hormones. So a lot of times with them, we will do the hormone replacement first. We'll get them balanced. We'll get them feeling like themselves again. And then it's just a natural progression of, okay, now I feel ready to kind of work on this next phase of my metabolic health. Other people, it's the other way around. The weight is really driving it. And so we will start on our weight loss program, and then we may decide to incorporate the hormones with that as well, because again, they work so well together. From a weight loss standpoint, I generally like to start people off on what I call kind of a metabolic reset, or a quick start. We do utilize some meal replacements, and there really is a science behind that. Our meal replacements are nutritionally designed by a weight loss company. You can't get them on the internet. It has to be through a physician-supervised weight loss program. They have 3 different kinds of protein in them. They are good quality proteins, but they have different levels of what we call satiety. So you're going to get an initial fullness with them, and then you actually get delayed fullness, so it keeps you fuller longer. It also has the right amount of an amino acid called leucine in it, which is vital for muscle protein synthesis. And in addition, then it's got minerals, vitamins, so you don't have to take anything else. It is a true full meal replacement. And most importantly, it doesn't have ingredients on it that you will see in shakes or other meal replacements over the counter that they use as preservatives, obviously to keep it on the shelves, but those are additives and preservatives that can actually drive hunger up and decrease your sense of fullness from these things. So I like people to do that for a couple of weeks, because it's also a way for me to evaluate what's going to work and what's not going to work. Some people think they're going to be hungry. They come back and they're like, wow, I actually wasn't hungry. Some people come back and they're like, well, I'm not physically hungry, but I'm emotionally hungry. So it lets us start kind of just getting into those details of what's going to work for an individual person. Every single person is different. What's driving their hunger, what's driving their eating, what's driving their metabolism is very, very different. And each visit, we're diving into all of those little things. And then all along the way, we are finding the program that's going to work for them, kind of for the long term. So again, I like that meal replacement. I do utilize medications. I would not say that they're my go-to, that they're a first-line agent, but for some people they are. Again, that runs the gamut. I have some people that are like, I'm trying to get off of medications. I really just want to kind of do this, natural. I don't want to use any medications initially. Other people are like, yeah, they really help them, again, kind of cross that bridge to get to the other side where they've got their head in the game where it needs to be. We can decrease those cravings. We can decrease that head talk, the emotional hunger, again, all of those other things that go into weight loss. So that's going to include appetite suppressants, metformin. Yes, we do utilize shots like semaglutide and tirzepatide. They have been very, very helpful in the weight loss world. I'm probably a little bit more of a stickler on those than maybe other people out there. And there's a reason for that. These medications, in some people, they are losing a pound of muscle for every pound of fat mass. That should be more like an 8 to 10 pounds of fat loss with only 1 pound of muscle mass in a healthy individual. And as we age, it is actually far more detrimental to lose muscle mass than it is to gain a little bit of fat mass. So it's also kind of taking what we call kind of muscle-centric health and incorporating that. So the program is really, okay, we're going to restrict for a little bit so that we can slowly start adding back, because we know that long-term restriction is not going to work. It is not going to be sustainable. So that's a little bit about what that kind of weight loss looks like. And then we do a full transition to maintenance. So if you're on medications, we're going to wean you off slowly over time, seeing again what's working for you, what's not working for you, what are you struggling with. So that's a whole phase. And then going into the maintenance phase, that is yet another phase, and it's a very active phase, but there are behaviors that we know when we've done the long-term studies of people who have been able to keep their weight off for the duration, habits that those people do, what we call weight maintainers versus weight regainers. So the whole time we're kind of incorporating those things so that when you get to maintenance, you're already kind of on that plan, but then we're able to transition you into that. The magic number is 5 years. People who maintain a weight loss for 5 years are more than 75% less. They have a greater than 75% likelihood of being able to keep their weight off. So that's that, again, what I call kind of that magic number. The hormone side of things, I have a lot of people ask me, well, do I have to stay on them? Is there, a time frame on it? And the answer is no. You don't have to stay on hormone replacement. I find most people want to. There are some docs that do this across the country that have patients that are 95 years old that are still getting their pellets and getting their hormone and running circles around people. So it's really a part of, again, that longevity and really what we call precision medicine, which is individualizing a plan and a lifestyle that's going to work for you as an individual, and not this concept of one size or one diet fits all. And again, there's going to be a lot of things that come up in between. And because we see you so frequently, we really are able to address those without delay. Say someone feels like their thyroid's off. We're going to be seeing you. We're not going to let anything get away from us because we're seeing you so frequently. We do like to get, again, a full panel of labs in the beginning. Generally, we recheck those in about 6 weeks, and then at a minimum every 6 months, we're repeating those to just look at how those biomarkers are changing with time. So that's kind of what a general weight loss, hormone, general wellness consultation is going to be like. If you have any other questions, certainly feel free to call us. You can get on our website, check out some other information, and we would be happy to answer any other questions that you have at any other time.